Well, I think that we can get started. My name is Leslie Wutsky. I'm the administrator with the radiation therapy program, and we're very happy to be here with you tonight and look forward to teaching you a little bit more about radiation therapy as a profession and giving you some ideas and pathways that will help you um, uh, to plan your journey towards becoming a radiation therapist or a student in our program, first of all, I guess. So um, I have with me tonight, I have Dennis Weber and I also have Shayla Pocket. Shayla's with the registrar's office and she's helping us up with the webinar. So she'll kind of be monitoring the chat and doing those kinds of things for us. She can also help answer questions that I don't know about some of the registrar stuff because I don't exactly know all of the things about the broader university. I know a lot about the program, but I don't always know all of the questions about the prerequisites and things like that. And Dennis Weber is here with us as one of our radiation therapy clinical faculty members, and he teaches with the program over at the Cross, and I'm very thrilled to have him with us. He's a radiation therapist by trade, but before we get started with all of that, let's start. Let's see if everything's going to work. There we are. Yeah, we'll start with a land acknowledgement. So we're excited to be talking with you today about this unique healthcare option. And I'd like to acknowledge that we're presenting to you from the University of Alberta, which is located on Treaty 6 territory, and it respects the languages and histories and cultures of First Nations, Métis, Inuit, and all First Peoples of Canada, whose presence continue to enrich our vibrant community. The Bachelor of Science in Radiation Therapy program is grateful for the opportunity to learn and practice on both Treaty 6 and on the traditional lands of Treaty 7 region in southern Alberta. And we'll get into that a little bit more in our presentation, but yes, we do have clinical placement sites across the province. All right. So, Dennis, would you like to just give us a brief introduction about for yourself?
Oh, sure. Yeah. Hi, everybody. Yeah, my name is Dennis Weber. I've been radiation therapist since the 1900s, so a little bit of time. And yeah, I basically worked at the Cross. I had the opportunity to work overseas as well. And then I've been teaching at the university for the last 5 years. And I work clinically with our students when they do their practicums at the or their clinical placements rather at the Cross Cancer Institute, and a little bit in Red Deer, and possibly a little bit in Grand Prairie in the upcoming spring. So really, really nice to virtually meet all of you, and look forward to answering any questions you might have.
Thank you, Dennis. Okay, so the first thing, whenever we start recruitment events, we always kind of have to talk about what is radiation therapy. And I think, Dennis, you would agree that it is sometimes a little lesser known healthcare career field. And since you're the expert, I'm going to let you outline to everyone what the heck is radiation therapy?
Yeah, thanks, Leslie. It's funny because I am sure that everybody here knows what it is, at least a bit, right? Or else I don't know that you would be here. But um, when you talk to sort of people in the public, they'll say, "Oh, you mean X-rays? Like you do X-ray?" And that's not what we do. So X-rays work in the kilovolt, in thousands of volts is what they deliver. We deliver millions of volts. So we deliver what's called a therapeutic dose. The radiation we deliver damages the tissue and does DNA damage basically, and kills the cancer cells. So normal cells have a propensity and an ability to repair themselves, but cancer cells are mutant cells, so they can't repair. And so with that machine that you see on the screen there, that delivers ionizing radiations in the megavolt range. And yeah, that's what we use, and we target it on various areas of the body wherever that cancer is, and we deliver the radiation with that. Um, Two main modalities of giving radiation. There's the external beam, which again would be delivered with that machine there. And then there's also internal radiation therapy, which we can actually put radiation precisely into various parts of the body. And that would be actual radioactive live sources that we use for that. So radiation therapists are a key member in the healthcare cancer care team. We work alongside the radiation oncologist, who would be your medical doctor who has specialized in radiation cancer treatments, along with medical physicists, nurses, dietitians. It's just a whole host of people that we get the privilege to work with. And yeah, we really are a critical role. We operate these machines. We do the planning for the treatments. We do the pre-planning for the treatments. We do a lot of molds and different various pieces of equipment, which you'll see in a video later on. Um, and we get to, I think the biggest thing is we get to work with these patients for up to 5 weeks. We get to see them every day. You get to establish a rapport. Um, and it's incredibly rewarding in that sense. So I think that's radiation therapy in a nutshell. Yeah.
Perfect. That's so perfect. Yes, that's definitely my understanding of the profession as well. So I'm not a radiation therapist. In my role, I do oversee the admissions process, and I work more on the administrative side of the program. So. But in the I started with the program when it came online in 2014. I've gotten to really understand what it is that radiation therapists do, and to really respect the role that they play in cancer patients' journeys, because these guys really do become the person that guides people through their cancer journeys in a lot of cases. Quite often, the therapist is the person, the healthcare provider that the patient sees the most. And I think that Dennis is right to say that there is a real connection between the radiation therapist and the patient. So I see this role as very much impacting directly the outcomes of cancer patients. Okay, so let's go on and we'll learn a little bit more about what a radiation therapist does during the day on a daily basis. So this next video that I'm going to share with you is actually something that was created by Cancer Care Alberta, and it is highlighting the new cancer center in Calgary, the Arthur J.E. Child Comprehensive Cancer Center that is in Calgary. And as you can see from the picture there, it's a beautiful new facility, and it has the latest and greatest of equipment and absolutely everything cutting edge. And you're going to see two therapists kind of talk about their day and their careers and what it is that they do. And one of the therapists that you're going to actually see in this video is one of our alumni, and her name is Reagan.
Our role as a radiation therapist is not just to treat the cancer, but the patient holistically. So we are a big emotional support for the patient.
So being someone that they can lean on for support is very gratifying and kind of gives that job satisfaction for sure.
My favorite part of my job is truly the patient. We can treat kind of anywhere between maybe 20 and 35 patients a day.
So some days I may be in CT simulation where we're doing CT scans to plan their treatments. There's other days where I may be working on the treatment form, so that's with the linear accelerator machines, and that's where we're actually delivering the treatment. So that's where we really get to establish a bond with our patients.
Get to build this great relationship and help them manage side effects from treatment. The technology is constantly changing in radiation therapy, and the whole goal of the evolution of radiation therapy is to increase the effectiveness of radiation therapy while minimizing the side effects to the treatment. For instance, our breast cancer patients used to have to come see us anywhere from kind of 20 to 30 times, and now some patients can be treated in the span of 5 days.
One thing that's nice about working in Calgary, it's not every day you get to work in a brand new facility, especially when you work in healthcare. Here at the Arthur Child, there's windows everywhere, we get natural light, there's wonderful outdoor spaces that both staff and patients can go to enjoy the outside. Calgary is the blue sky city, so we typically get some nice weather here that's nice to enjoy on a break.
So I have worked for the past 20 years with Cancer Care Alberta, and it has provided me with amazing opportunities for learning and growing and just building an amazing community within not only our center, but within centers across the province.
Just seeing the impact that we can have by just showing up, and it is just our job, but it's a pleasure to be able to offer that to patients.
A little glimpse into what a day in the life of a radiation therapist would look like, with a little extra bonus plug of come work in Calgary, which is I'm sure that all the other centers across Alberta are like, no, come work here, come work there, but that's a really nice video that they were able to put together, and it is nice to see that beautiful new center highlighted for sure. I think that Dennis, how do you think that did it do a good overview of like what a radiation therapist does in the day? It kind of mixes up a little bit between, all the different things that a person might do. I think everyone that has joined here tonight is interested in that, but I think that probably what they're going to be even more interested in is what does an actual treatment look like. And on our next slide here, I have another video.
Our role as a radiation therapist is
go here. There we go. And actually, I'm going to click on this and it's going to take us out to YouTube. So that might take a minute, and I'm hopeful that you guys will still be.
Hey, Jen.
Hi.
We have our radiation therapy.
Shiloh, can you still see everything and hear everything? Awesome. Okay, I'm going to blow that up. And in this video, we actually have
student joining us for
we have two of our radiation therapy faculty members, Brian Schwill and Jen Dewhurst, and they are actually over at the Cross Cancer Center here in Edmonton in our training suite, which is actually Dennis's home. His office is actually located in that same training suite. So in this short video, they are going to go through kind of the setting up and full treatment of a standardized patient. And in our program, we use standardized patients quite a bit for training. It helps you as a learner to be able to go into that training suite and practice on not a patient, but on an actor, and get your skills up before you actually enter into the clinical setting. But what I'm going to do is I'll play this video, and we'll have Dennis, you can talk as much or as little as you want through this, but maybe at the end do a kind of a overview of it, or how do you want to do it?
Let's see what happens, Leslie. Again, there's music, so we'll see. I'll maybe talk a little bit throughout, but it goes pretty quick. It's challenging to keep up. So I can definitely mention after. So yeah.
Okay, that sounds good. I'm going to hit the play button, and we'll go from there.
This treatment.
Hello.
This is Trina.
Nice to meet you. Welcome. Nice to meet you too.
You ready to go for the next patient?
Yeah.
Right.
No.
of the first things we do when we get into the room is we're going to straighten and level the patient. That's what Brian and Jen are doing here. We've got those lovely lasers, incredibly accurate. So they're going to line the patient up so that every day during their treatment, they're exactly as they were in the CT simulator when they were planned. We're really precise. We want to be within a few millimeters with everything that we're lining up to. So those lasers are going to be lined up to that shell. You can see that that's an immobilization shell that we use to just basically keep the patient still and ensure that we are treating exactly what we're planning to treat. Once the shell is on, you can see Brian and Jen lining those lasers up. They're going to do a few checks beforehand. Before we leave the room, again, patient stays where they are and the machine rotates all the way around them, delivering radiation wherever needed as planned.
Start on that lateral image.
Afterwards, we come outside of the room and basically what happens is we overlay an image from today with the one the patient was planned on, and then we're going to adjust and move it even just a few millimeters to ensure, again, that we're exactly where we want to be for the treatment.
Lateral, beautiful.
Appointments are about 15 minutes. 10 minutes of it would be the setup. The treatment itself probably takes 3 minutes.
One more thing, I just wanted to remind you that if you do need, we have a nutritionist that you can see. We have her on standby. We just have to send a referral over, and if you ever want to talk about ways to get better nutrition, you just let us know, all right?
Great.
All right, thank you.
Have a wonderful day, sir. It was nice to meet you.
Thank you, Jen.
I'm going to clean up the room, okay? Trina, it was nice to meet you. Have a wonderful day. Thanks.
There we go.
And then, yeah, after the treatment, we want to we want to have enough time for the patient. So again, their radiation side effects are going to be cumulative, probably not much in the first few weeks, but then after that, they could build up. And so we just want to be there to check in, help them out any way we can, either give them the advice they need or refer them on to the wonderful professionals like dietitians or nurses that would have maybe more specific and tailored information for them.
So much more than just sort of pushing buttons on a machine. Hey, Dennis? Like it's such a combination of technology and patient care. That's one of the
really has.
Yeah.
You're absolutely right. So yeah, it really has gone a long way, and the patient care aspect is really, really important. But the technology, as you had said, very, very important as well, with lining up those images and ensuring that we are treating exactly what we want to treat.
Yeah. Awesome. Okay, let's move on. So I think that as a radiation therapist, it feels like to me, you would have lots and lots of responsibility in the care of your patients. And when you think about yourself and your colleagues, we've got some of the kind of the key qualities listed on here, but when students are thinking about, okay, am I a good fit for this program, for this career? Would you agree, or is there any other qualities that you can think of that you would add to that list that are important for radiation therapists?
Yeah, thank you. This list is excellent. Very, very accurate. Empathy jumps out at me. I think that's probably one of the most important qualities in any healthcare worker. But well, also resilience. Obviously, resilience is really, really important. It can be very, very challenging to find that work-life balance when you're caring for people all day. It's tiring, right? So being a resilient individual is important. And a team player is really important. Again, we never work alone. You're never going to see any video here with somebody solo. We're always collaborating with a radiation therapist or, again, nurses, oncologists, physicists, somebody else. So yeah, being able to work well in teams is very important as well.
And I think, when you talk about sort of the work-life balance thing, Dennis, one of the the things that quite often gets brought up is the ability as a radiation therapist compared to other healthcare professions. There's no real shift work involved. It is clinical hours. So I do think that that is another, compared to some similar, well, I don't think there is any comparable similar healthcare fields to radiation therapy. It's pretty unique. But when you talk about nursing or something like that, it is kind of a real benefit that it is a Monday to Friday, 8 to 4 or 7 till 3 kind of job. Yeah. So I think,
Absolutely. Yeah. That's a great point, Leslie. Yeah, that is yeah, your weekends are your weekends. It's really important.
yeah. Yeah. So I think your days you're working really hard and sometimes there is a lot of heavy stuff that you're having to deal with on a day-to-day basis, but you also have that ability to catch up and have your own time and be your own person as well. So I think those are really, really important for any healthcare worker, but in particular in this field as well. Okay, so let's see, where are we going next? So yes, a lot of people when we are doing recruitment, people are asking about, well, what opportunities, once I become a radiation therapist, what's the trajectory of the job? Where do I go from there? I am a therapist. Am I every day just on the floor treating patients? What does it look like? And I think Dennis is going to talk to you a little bit about that, but I think I would be fair in saying that it's quite different for each individual therapist. Would that be a correct statement, Dennis?
Yeah, thanks, Leslie. Absolutely. I think in the previous video, Reagan had outlined the many, many different things she gets to do in a day, like whether it's on a linear accelerator treating patients, she was on an orthovoltage treating patients, another machine vastly different. Sometimes she's in the pre-treatment area doing CT simulation. You could be in an area called dosimetry, which does the planning of the treatments. In Edmonton, we have a gamma knife at the University of Alberta, one of the only ones, I think, in Western Canada. And that is used to treat CNS, brain treatments are done over there. So again, that's another opportunity. Calgary has an MR Linac, which is again another very specialized piece of equipment. So in terms of actual treatment and on the floor, there are a variety of roles that you can do. But if we go down that list there's opportunities for research. We need partners to work with our students, so there's the mentorship ability as well. Um, any healthcare profession is just such a great stepping stone into management roles. Um, you can come work with me in education and become faculty at the U of A. And this is really exciting. We have some advanced practice roles. So these are radiation therapists that have done more training. They've gone sort of the masters in advanced practice radiation therapy, and they are working like prescribing for patients and sort of like advanced practice nurses, but for radiation therapists. So that's a wonderful, wonderful role that's coming up in the province as well. And there are, of course, opportunities to volunteer or work with our governing bodies at the CAMRT, which is the Canadian Association, or the Alberta Association as well. Um, did I miss anything? I think that's there's
Oh yeah.
lots. It's
Yeah,
great.
I so agree, Dennis. That's such a great point about a career in care. I think it opens up your opportunities broadly because anybody that works in healthcare, I think, has the knowledge and awareness of the human condition to be able to work and be successful in a lot of different areas. So, yes, I think there's great opportunities to start out as a radiation therapist, but then you can grow into so many different directions for sure. All right. So here's a map that is showing all of the different, I skipped ahead, I'm so sorry. Let's go back. Did that go far? Okay, there we go. Sorry about that. My mouse must be clicky, extra clicky today. So the map is showing the 5 different cancer centers in Alberta that currently offer radiation therapy. Students may participate in clinical placements at any one of those 5 centers. So there's Grand Prairie, the Grand Prairie Cancer Center, which is a brand new, well, it's not brand new, but it is a newer center. It's beautiful. I had the opportunity to go up there last spring. Um, uh, and then Edmonton, of course, has the Cross Cancer Institute. Red Deer has the Central Alberta Cancer Center. Calgary has the new Arthur J.E. Childs Comprehensive Cancer Center. And then Lethbridge has the Jack Addy Cancer Center. So those are kind of the 5 main centers in Alberta. And we, because the program here is at the U of A, we have our training suite in the Cross Cancer Center, but our clinical placements can be at any one of those 5 centers. So Dennis, once a student finishes the program, they will need to write a national examination with the CMRT. And when they've successfully completed that, they can practice anywhere in Canada, correct?
Yeah, that's correct. Our program and our national exam is recognized across the country and in many other countries as well. So I know you can definitely work anywhere in the Commonwealth. So uh, Australia, UK, New Zealand, all of much of Europe and the Middle East recognizes our credentials as suitable for employment in their countries. So yeah, absolutely. It without further tests, if that makes sense. The U.S. requires us to go down or go online and take another exam. Some of our students have, and they have said it's been okay. It hasn't been. Ours is a rigorous test. So yeah. There, I'm not going to say anything more, but yeah, you are absolutely able to work anywhere in the
You
country.
more than likely would be success. If you pass the Canadian exam, you would more than likely be successful at writing any other exam. But in
Yeah,
a lot of
our like
countries, you don't even have to write the exam. They just accept your qualifications from here. Yeah.
exactly. Yeah, I mean our exam when I wrote it, I want to say it was 6 or 7 hours, and I did go down to the States and wrote theirs, and it was it was probably an hour, an hour and a half. So it covered everything, but it was a much more condensed exam.
It's
So
different in those in the States as well. And there's different,
that's right.
yeah, different things like that that impact. And Dennis, you did practice outside of Canada, correct?
I
Where
did,
did you?
yeah. I had the privilege and the opportunity to work in Hong Kong. So I worked there for a year and a half. And again, this is many, many years ago. They were switching from a diploma program to a 4-year degree program. So they had 2 years where they didn't have any grads, and so they needed some therapists to come in for basically locum. So yeah, it was a wonderful experience, and met some really great people over there. So yeah, many opportunities like that out there for sure. Some
Yeah.
of our new grads from, I want to say 2 years ago, just recently moved to New Zealand to work there.
Yeah.
So there are a lot of opportunities throughout the world if you're adventurous and you want to try working
Want to
somewhere
travel?
else.
Yeah, absolutely. Well, because the other thing that's impacting that right now too is that there is a real shortage of therapists in the province and across Canada and actually internationally as well. So there's a real big need for people to fulfill these roles. So we're glad you're here tonight, considering it as an option for sure. Okay. That's about where you can practice. Let's see, now we're going to click and we're going to get into some pathways. So I'm not sure who our audience is tonight, but I always kind of start, when I talk about pathways, I do start with a high school student. So just to think about if you are a high school student, we really encourage you to think about taking your top level in your math and sciences. The reason for that is because once you get into university and are trying to work towards completing the prerequisites for the program, having, your math and your bio and your physics, all of those at the 30 level makes it a lot easier to get into the prerequisite courses that we ask for. So you go through your high school and you graduate high school, probably somewhere along the lines in that before you've actually graduated, you're applying to post-secondary institutions. And of course, we would love for you to come to the University of Alberta and apply here. Here at the U of A, you can get, and this, Shayla, you might have to help me with this, but I do believe that the prerequisites for our program can be accessed for sure through both arts and science, the Faculty of Arts and the Faculty of Science. And I'm not sure, maybe even other faculties, I'm not sure, to be honest.
I definitely recommend science and arts being kind of the best route, I would say. A lot of the courses are pretty accessible to everybody, but I think, yeah, arts and sciences are usually like the
Just a
best
little
route for
easier,
students.
okay?
Yeah.
A little more
'Cause
direct. Otherwise, yeah.
Yeah, some programs might be really specific to the courses you need to take, like engineering and nursing, for example. They're very specific with the courses you need to take in those programs. So those might not be the best pathways to take. So usually arts and sciences are way more flexible. That would be my recommendation.
Yeah, perfect. Thank you. I'm glad to hear you say that. That's wonderful. That's usually how I advise. And it's a little easier to go into those without needing a major or a minor for the first few years and all of that. So it does kind of clear the path for being able to do your pre-professionals and then go into other programs that aren't direct entry. So yes, so we're not a direct entry from high school program, I guess I should say, as we talk about pathways. You do have to come into university and take some courses, 30 credits worth of coursework, and we'll talk about that in the next slide. And then you apply to our program. So let me go on to our next slide and we can talk a little bit more about that. In this slide, I'm outlining the prerequisites. We do have a change, an expected change coming for the fall of 2027 intake. We are expanding our curriculum. Dennis talked a little bit about the different technologies that are out there and the expanded roles that radiation therapists are taking on. Our competency profile is changing and evolving constantly. So we have to change and evolve constantly. And with that, we are having to make more room within our 3-year program layout. And so as part of that, we've taken the physiology course, 6 credits worth of physiology, out of the prerequisites out of the first year of being in the program and put them into prerequisites. So that's kind of the difference between those two, the fall 2026 requirements and the fall 2027 requirements. The big change is that from the 2026, we've taken out the sociology or psychology 3 credits, and we've also taken out 3 credits of the physics. And the reason for that is that we were finding our physicists that teach within the program were finding that the physics taught at the broader level of the university didn't actually get to the nuggets that they wanted them to get to. So students were coming in and they would have to reteach, or not reteach them, but have to actually teach them the basics that they had hoped that they would get in their prerequisites. To ease that transition, though, that's been built into the first year physics courses that we have. So that's kind of the big difference between those, and changing that has opened up quite a bit of room within our program layout. And that's my next slide is our program layout. So this is the current program layout, and this is what the up until the 2026 cohort would be taking. So you can see the first year is the pre-professionals. There is no requirement to complete your pre-professional courses in 1 year. It is, you can do it in 1 year, so it's a nice option. And if that is who you are and that's your ability and you can be successful in doing them in 1 year, by all means, go ahead and do that. But we have to make it very clear that there is no requirement and you are not penalized in any way, shape, or form in the admissions process if you do take more than 1 year to complete your pre-professionals. So that's year one of the program. We actually do transfer the credits from that, the 30 credits from that into the program. So that makes up your whole 4-year degree program. And then the rest of the time, fall, winter, you're in full-time classes. And that's something that you need to kind of keep in mind. If you do take courses for your prerequisites and you never do take 5 courses at one time, you do have to have awareness that there will be you will be doing full courses, for full course loads with labs when you're in the program. So we are a professional program, and with that comes different expectations than just a regular degree program. We do have, generally our students kind of explain that it just feels like there's higher expectations for being prepared for class. So a little bit more reading and a little bit more prep than what you might find in your regular undergrad degree courses. And just the expectation, that you're going to perform well on a full course load. So fall, winter is just regular didactic classes. The first spring, you're going to go into your very first clinical placement, and that can be at any one of those 5 sites that we talked about. And then that next fall, winter, you're back into regular classes, full course load. And then the spring, summer, you go into a 13-week simulation course that happens over at the Cross Institute, where basically a mock clinic is ran and you get to practice lots with standardized patients. Sometimes we actually even have volunteer patients that come in, cancer survivors that volunteer their time and work with our program. And I would say that some of the students' experiences that they have with those volunteer patients are some of the most valuable, because a volunteer patient is willing to say, whoa, you would never talk to a patient like that. And if you do, this is how you'd make them feel. So don't do that. And it just seems to have more meaning than if Dennis says it to them or one of the other instructors, so, or a standardized patient even for that matter. So we're really lucky that we have good partnerships with the patient survivor group. And then your final year is all clinical placements. So you've got a fall and winter terms of clinical placements, and that's when you would be seeing Dennis or Carrie or Cynthia, one of our 3 kind of clinical faculty members, a whole lot, but you'd also be in clinic, learning everything that you need to do, taking all of that scientific underpinnings that you've learned throughout the didactic years and actually applying them clinically. So that's what our program looks like. And finally, just a little bit of an overview of what the actual admissions process looks like. So applying to the program started in October 1st. So for the fall 2026 intake, October 1st of 2025, it opened up and you would apply. And then the next thing that is expected of you, would require you to submit some of your transcripts. We need to have a look at what your GPA is on those pre-professionals. We're also going to, take a look at your career reflection letter. So for the first look that we have of you is through your pre-professional GPA, your overall GPA of the last 2 years of full-time study, if you have that, and then your career reflection letter. And using the results, they all have numbers attached to them, and the career reflection letter, they're graded by a couple, or not graded, but they're looked at with a rubric by a couple of different people. And with that, we rank everyone. And once we have the ranking of everyone, we make a determination of how many people we can bring in for interviews. And then we will put out invites for people to come for multiple mini interviews. And that's a very interesting process. It's like it says on the screen here, series of short, carefully timed interviews, and they're situationally based. So basically, it is our way of looking at you through the lens of how would you be in a room with a patient when they perhaps ask you an uncomfortable question. Are you going to be able to respond appropriately in an awkward, challenging situation that might make you feel a little bit uncomfortable? When we're looking at your transcripts and all of that, that helps us better understand how you're going to be as a learner in our environment. And we do need you to be a good learner, a strong learner. That's important, but it's also really important that you can also, be comfortable with patients and have a good rapport with patients. And we use the MMIs to help us understand how you're going to be in that realm. So students might come in with very high GPAs, but then they don't perform very well on their MMIs. So when people focus on their grade points and all of that, I get that. It is important, but I must tell everyone that just because you have a really high GPA, it doesn't necessarily mean that you're going to get into the program. We do weigh the MMIs fairly heavily, and it is important that we can see how you would be with the patients, because that's really important. At the end of the day, we are trying to positively impact patient outcomes. That is one of our main goals in the program. So, and I'm happy to answer any more questions about those MMIs if there are any. We're just about wrapping up here. I think actually that is my last slide. So hopefully everyone knows how to apply. You're going to go to that the uab.ca/apply, and we're found under professional programs. So when you're searching, you need to find that professional programs, and then we're under the medicine and dentistry. You'll find a radiation therapy program, and you can apply there. If you would like more information, please feel free to have a look around our webpage. And you can also reach out to our general email account, radth@UAlberta, and we're happy to answer any questions that you may have. I think that's everything I have, though. We're happy to answer any questions that you may have. I think, Shayla, there's a Q&A? People have the ability?
Yeah, if anyone has any questions, I see there one is just a question in here right now. But yeah, if you have questions, please use the Q&A function. That's like the easiest way for us to answer your questions. Try not to put them in the chat, but just put them in the Q&A and we will answer your questions.
Okay, so starting salary. Dennis, I want to say close to 90,000 at this point.
I think so. Yeah. I think it's around $44 an hour, something like that. I mean, I'm pretty sure you can Google that and find that out. But yeah, I think it's a pretty decent starting salary for leaving university with a degree, really.
Yeah.
I think a good place to look for this would be the Alice website because they might have job postings and stuff on there. So I can send a link to that website in the chat and you can take a look and see what might be on there. But that
We
sounds
have
about right
Wonderful.
to me.
our
Thank you,
website.
Shane.
Oh, you know what? I can probably go there. Am I still sharing my screen? I probably am. Hey.
Yes, you are. Yeah.
So if I go here to our website, we actually have, there's a great video that, so here's our website. Oh, and we do have, I do monthly advising sessions as well. And those are just a Zoom meeting that you can sign up for and put your questions in and basically we just answer questions. This right here on the right hand side is they've done a really good video of about radiation therapy, and it does take you right into that. What I think, yeah, there we are. Yeah, so great video to watch. Actually, Dennis, you maybe haven't even seen this one. This is actually one of our alumni as well, and they go into quite a bit in depth, more in depth than the videos that we have shown tonight. But there is perfect, Sheila. Thank you. But it's almost too long to have brought into this discussion. So they had it as 73. I think that's low. I don't know. Would that be with the new contract, Dennis?
Well, I I think what they have listed as an average wage, I do believe that's the starting wage, to be honest with you.
Okay. Yeah. Okay. I think that, but anyways, I know there is a new contract and it is, I think it's a little bit higher than that. Anyways, I could be wrong. Who am I to question our government? Okay, is there any other questions? I think that's it.
We still have about 10 minutes, so if anyone has any other questions, feel free just to pop them in the chat there.
Absolutely. We're happy to answer them for sure. Anything about the prerequisites we can certainly answer, or anything about, you can really ask Dennis, get some info about the career itself. Dennis, what's your favorite chocolates that you get, and how often do you get chocolates from patients?
I don't get them anymore.
I know, right? Because you came over to the education side.
Yeah, it's unbelievable how many chocolates are still around the machines because of Christmas. Yeah, our therapists are well taken care of with the patients. They're very appreciative. Yeah, there's always food everywhere. It's wonderful.
And Dennis, who would you say, I'm going to ask some questions. Who would you say, and maybe I can stop sharing my screen, probably don't need that any longer. Like on a day-to-day basis, other than the other therapists, who are you interacting with the most? Would it be like the medical physics teams, or is it like your OT, PT, nutrition people, social workers? Who do you find is like, other than your fellow radiation therapists, who are you interacting with the most?
Great question. It depends on the day, but yeah, no, I think mainly it would be nursing, just sort of collaborating for patient care and treatments, or the oncologist, so the radiation doctor, if we have any questions. And you're absolutely right. I want to say every day we would talk to a physicist or somebody in the physics department, whether it's regarding, the machine or some of the treatments and doses that we're giving, if we have to have conversations with them. But yeah, I would say those would be the top people we talk to on a daily basis, other than each other. There's a lot of
Right.
us, those. What are we at the cross now? Like 80 or so,
Yeah.
probably. Yeah.
I think so the stat that I've always used across Alberta is there's 250 therapists. And then uh, across Canada, I think it's about 2,500. So in terms of like, if you compared that to nursing, it's a very, very small profession,
We're
right?
little.
Yeah.
Looks like Tori has a question though. Do students have a say for their clinical placements? So Leslie, I know that's your
Great
jam.
question, Corey. Yeah, that is my jam. So you do have somewhat of a say. We always ask students what their preference is. So you're given all kinds of forms and things like that that you have to sign when you first come into the program. And one of them is asking about your preferences for clinical placement sites. So we do ask that students attend at least 2 different clinical placement sites, because the reason why we have that is actually to benefit you. You get to see every site has its own nuances. And Dennis, maybe you can talk a little bit more about that, but there's different machines, right? At the different sites. So you would have to be in at least 2 different sites. That's kind of our one requirement, but you can tell us where you prefer to be for those placements, and we do our best to match that. If worst case scenario, we can't fit everybody in where they want to do, and people aren't. What's happened in the last few years is people have very graciously worked together within their cohort to figure out who's going to go where and do what. Very, very, very rarely we have to pick names out of a hat and tell somebody you have to go here. Sorry. And I hate doing that, but yes. So why is it important that they go to different sites and experience different sites?
Right. Yeah. Thanks, Leslie. So clinical placement 1, which is is that third year that they do, or the second
In
year?
between year 2 and 3, yeah.
Okay, yes. So that is a 5-week basically course where you're going to be in one of the sites, and that could be in any site in the province. But as Leslie said, the students have worked out really, really well as to who wanted to go where. And the last 2 clinical placements, those 8 months, which would be basically they're divided into 4 months and 4 months. At least one of those has to be in Calgary or Edmonton, and the reason being for that is some of the more complex techniques and sites are not treated in Grand Prairie, Lethbridge, or Red Deer, and so you need to get that experience at Calgary or Edmonton. So yeah, basically those last 2 rosters are for the most part in Calgary or Edmonton.
Yeah. We are experimenting a little bit with doing some placements at the smaller sites, but you would only be able to do the 1 term at a smaller site, and then you'd have to go back to the bigger centers, because just exactly what Dennis said, it's the 2 main centers of Calgary and Edmonton that treat all of those tumor groups. Yeah, that's not a good day if you have to pick names and tell somebody, sorry, the worst day. It's almost up there for me for when we have to make the admissions decisions as well, because those are tough days when you have to tell somebody that they didn't make it. Because quite honestly, sometimes when we're doing our rankings of who's coming into the program and not, and we're at the admissions committee, it's like within like 0.02 of a decimal between somebody who gets in. Okay, not that much. I'm exaggerating, but it's so very, very close that, had it been a different grouping of applicants, that individual would have made it in that year. So we do encourage people, if they are thinking about, coming into the program and they apply and don't make it in the first time, and they think that they do want to be in this profession, please apply again and try it the next year. How are we doing, Shayla?
Good. It looks like we're still waiting for some more questions if anyone has any.
Awesome. And we should talk about how many people actually get accepted into the program too, because it's really important that students understand the competitive nature of the program. So in talking about the small numbers of therapists across Alberta and across Canada, our program too is quite small. We are capped currently at 15 students. So we do only admit 15 students each year. So that does also add to the competitiveness of the application process. So it is, yeah, but don't let that deter you. And I say that because I think if somebody has come to an event like this, obviously it's something that's piqued your interest, and it is a really unique individual that we look for in the program and in the profession. So it's not everybody that has that technical side and that patient care side to them. So if it is something that you're like, that is who I am, that's where I sit, please do not hesitate to apply to the program. Anything else? Any words of wisdom, Dennis, to wrap us up?
No, I think I've shared all of the knowledge I possess. So thank you. I mean, thank you everybody for coming. Thank you for the wonderful questions. And again, if you have more questions, where would we be emailing to, Leslie?
You email to the radth@ualberta.ca, and we will do our best. And you can also sign up for those on our website, those admissions sessions that we have. And we're happy to have you and answer any questions. And hopefully we've kind of inspired you to look a little bit deeper into this as a possible career.
Awesome.
Yeah. Thank you so much, Shayla, for helping out.
Yeah, no worries at all. Thanks everyone for coming today.
Yeah.
We're really happy to have you here.
All right.
Is it time?
I believe so. Well,
I
it
think
looks like no
so.
one else has any questions. That's totally fine. Like Leslie said, if you have questions, please feel free to email, feel free to book an advising session with her. She can definitely help you out.
Absolutely. Yeah, and if you got questions about the other side, the broader university, maybe not Shayla specifically, but the registrar's office will definitely help you out with those student services, I guess. Shayla, is that the best way to?
Yeah, if you have
pursue?
if questions about requirements, like my colleagues with the transfer team can definitely help out.
Yeah.
But like
Yeah.
any inquiries about transcripts or finances, things like that, student service would be the best place to go for that.
Awesome. Awesome. Oh, I should have talked about, I don't know if anybody is a transfer student, because one of the great tools that the university has just recently created, and we point a lot of our prospective students to that, is that transfer credit tool search. That is something that if you want more information on kind of how to determine, is this a good, can I transfer from, I don't know, a post-secondary institution in BC somewhere, you can actually look up and see perfect. Thank you, Shayla. That's wonderful. Excellent tool.
I use this tool a lot, so
I got
it's like my life. But yes,
I
please
know.
use this tool if you're a transfer student. It'll help a lot.
Yeah.
But we are at time, so
Good.
there is
Thank
one
you
more.
so much. Oh, one more last question.
We'll answer one more question and then it is that time.
GPA look like? That's a great question. We do get lots of questions about sort of what our admissions, GPA is, and so my canned response to that is that we don't have one, which does not satisfy people when I say that at all, because it does depend every year on the applicant pool. So it does ebb and flow a little bit. Really, what we say is that if on those pre-professional courses, if you have a GPA that's 3.0 and above, that almost always is going to at least get you in for that MMI interview. And that's where the game changes. Once you kind of make it past that first hurdle and into those interviews, and you can really show us who you are, your chances of actually getting into the program go up significantly at that point. So I would say aim for a 3.0 and above in those professionals, and you should be fine. But again, it does depend on that applicant pool.
Alrighty. Well, I think that must be everything. But again, thank you all for coming today. We're really happy to have you here. And thank you, Leslie and Dennis. It was so great, again, hearing all the information. I love hearing about this program. So
Cool. We're pretty lucky. And yeah, we're happy to present, and we appreciate your time and the ability to do this.
Of course. Awesome. Well, I hope everyone has an amazing night.
Thank you.
Thanks, Shayla.
Take
Thanks
care.
all. See you.
Bye.